Hello, my name is Dr. Dana Williamson, and I'm a chiropractor in Mechanicsville, Virginia. Everyone, well, at least almost everyone, has had headaches from time to time, and we all know how miserable they can make us feel. In fact, at some point in time, 9 out of 10 Americans suffer from headaches that range between mild and dull to throbbing, intense, and debilitating, sometimes to the point of requiring bed rest in a dark, quiet room. The common reflex is to reach for that bottle of pills and pray the headache subsides so you don't have to call in sick and lose another day of productivity when you have so much to do. Unfortunately, between the side effects of many medications designed to help headaches and the pain associated with the headache, this approach is frequently not the answer. So what is? The good news is that many studies have identified spinal manipulation therapy, the main type of care utilized by chiropractors, as being very effective for popular types of headaches, in particular tension-type headaches that arise in the neck. An important 2001 study reported that spinal manipulation therapy provided almost immediate relief for headaches that arose in the neck, with significantly fewer side effects and longer-lasting results compared with commonly prescribed medications. Another interesting study found that patients receiving spinal manipulation therapy had continued to experience sustained benefits throughout the following weeks and even months after treatment stopped, in contrast to those in a medication treatment group where headaches came back almost immediately after they discontinued treatment. The most commonly prescribed medication for tension-type headaches are non-steroidal anti-inflammatory drugs, or NSAIDs. Common over-the-counter options include ibuprofen, such as Advil or Nuprin, and Aleve, which is otherwise known as naproxen. For those who can't take NSAIDs because of blood thinning and/or stomach, liver, kidney problems, doctors commonly prescribe acetaminophen or Tylenol, but it can be hard on the liver and kidneys, especially when taken over time. So, what can you expect from a visit to a chiropractor for your headaches? The typical approach begins with a thorough history and examination, with an emphasis of evaluating the neck and its associated function. Your doctor of chiropractic may also perform tests designed to reduce pain and some that provoke a pain response to identify the pain generator or cause. Because each patient is unique, the type of care provided will be individually determined based on the findings, the patient's age, comfort, and preference of both the provider and patient. So the next time you find yourself reaching for pills because of headaches, remember that there are better options. Give chiropractic a try. You'll be glad you did. We realize you have a choice in whom you consider for your healthcare provision, and we sincerely appreciate your trust in choosing our service for those needs. If you, a friend, or family member requires care for headaches or neck pain, we would be honored to render our services. If you'd like to view more articles like this one for free, visit www.mechanicsvillechiropractorblog.com.